This is the life cycle of Leishmania, different types. Female sandflies, intermediate hosts or vector, and mammals, they are definitive hosts. First, promastogote actively invade the neutrophil granulocytes. Then granulocytes are phagocytes by macrophages. Promastogotes then invade them. Promastogotes transform into amastogotes and multiply by simple division. Amastogotes leave the infected cell. And so this is the life cycle. Actually, the promastogotes migrate the pharynx valve of the insects, then through the bite, they goes to the blood of the human where they invade the macrophages and multiply, transforming into Leishman stage in mastogotes. So simply premastogotes from the insects transform in a human into mastogotes. This is the female sandfly genus Phlebotomus. These are forms of cutaneous leishmaniasis or skin ulcers. As you see, wet forms and dry forms. The deeper is the wet form, and as you see, the dry form is less clear than the wet ulcers. These are the pictures of children with visceral leishmaniasis. Note the hepatic and splenic enlargement. hepatosplenomegaly اللي هو التضخم الكبدي الطحالي. Pathogenesis and clinical symptoms. Visceral leishmaniasis. It is called Kala-Azar or black disease in Hindi language and caused by Leishmania donovani, which spreads in both ancient and modern worlds في جميع القارات الحديثة أو القديمة. The incubation period in this disease is about 2 to 4 months. Symptoms are characterized by intermittent fever, hepatosplenomegaly, liver and spleen enlargement, general weakness, dysfunction of the vessels and lymph nodes, and darkening of the skin, which gives the disease the name a black disease. The patient gets jaundice, the liver is damaged. People may also experience oral gangrene, noma, because the scarcity of granular white blood cells, granulocytosis, and complication of lung and intestines. The percentage of albumin decreases and the proportion of globulin in blood increases. But the cutaneous leishmaniasis is called tropical sore or oriental sore, caused by Leishmania tropica, which is characterized by two types. Leishmania tropica major causes a wet skin ulcer, while Leishmania tropica minor leads to dry skin ulcers. The incubation period extends from 2 weeks to 8 weeks, where the lesion is located in a visible area of the body, usually beginning with itching, which is surrounded by redness and the stiffness of the tissue. With ulcers, itching develops into a swallow-deep ulcer that heals within 3 to 12 months, leaving a clear scar. The ulcers are often single, but there are many in rare cases. Secondary complications may occur as a result of bacterial infection in this area. In the case of dry ulcers, the itching does not develop into an ulcer and heals slowly over a year, and more leaving a slight scare. Diagnosis: visceral leishmaniasis. The clinical manifestations of liver and spleen enlargement in endemic area suggest the disease is a sign of infection, but a laboratory examination for detection of Leishmania donovani in samples from biopsies taken from the liver, spleen, bone marrow, and lymph nodes, once installed and stained with Giemsa stain or hematoxylin with iodine, gives evidence of infection, or by immunological examination for detection of antibodies to the Leishmania donovani. Skin cutaneous leishmaniasis by taking a swab from the perimeter of the boil or as and scratch after peeling off, or take a drop of the edge and brushes in a glass slide and then fixation or staining with Giemsa or other stains, and then examine under microscope to see leishmanal forms, or by test called Montenegro test, which depends on induction of germs of the skin with vaccine of Leishmanial stage. Positive results are obtained in most patients. Immunology and prevention. Leishmaniasis spreads in the visceral and skin forms in different parts of the world. It spreads in the Arab world, Africa, Asia, Central and South America, and found in Palestine and Jericho. Prevention depends on treatment of infected cases in a human being, a storehouse of infection, and health education of individual in ways of transmission the disease and its adverse effects. Second, advise individual to cover the location of the skin injury to reduce the chances of transmission of infection among family members or other individuals. Third, elimination of infected bugs and rodents where they are reservoir hosts of disease. Elimination or control of vectors, the sandflies, using available pesticides and eliminate them in places of reproduction. Avoid exposure to these insects by wearing thick clothes and use the mosquito nets during the sleep and development of network of fine wire that prevent insects from entering homes, and use the best repellent of the skin directly or on outer clothes. Leishmania treatment. The treatment of leishmaniasis is not always successful. We now have new types of chemical treatment, some of which have proven effect, while others require further testing, surgery by liquid nitrogen or using infrared, but sodium stibogluconate and its commercial name Bentustan is the most effective medication in the treatment of skin and visceral leishmaniasis, but it is expensive.